Um, Dr. Bingaman, can you kind of set the scene for us? What are some of the risks associated with organ transplants during this time, during COVID?
Sure. Organ transplants really are a wonderful gift, a gift of life for our patients that oftentimes wait years before they can receive this gift. But of course, the success of transplant depends upon patients taking medications that keep the immune system down. These medicines are vital because they prevent rejection of the organ, and they've got to be taken every day. But because our patients are on these immune suppression medicines, they are more vulnerable. They're more vulnerable to infections in any times, but especially in these complicated times with COVID and, of course, the cold and flu season coming up. And so since our patients are so vulnerable, really we've got some strong messages for them and their caregivers to be staying extra cautious and extra safe. So that means, of course, masking. It means, of course, social distancing and frequent hand washing, absolutely critical to staying safe. Another really strong piece of advice we've got is for making certain that patients keep up with their doctor appointments. Folks have been scared to leave their homes to be fearful of catching something, but they've got to keep up with their doctor visits. And, many of these visits can be done now at home through their phone or through their computer with telemedicine. And so we're strongly urging patients to reach out to their doctors and make certain that they can keep up with their visits, hopefully through a telehealth visit. And finally, blood work is so important to be monitored in our transplant population. It's important that the blood be monitored to be certain that the organs are functioning normally. And again, we're really encouraging our patients not to skip these very important blood draw appointments.
So do you think that that's really the most important thing for patients to know, that they need to be diligent with their doctor visits?
I think that's absolutely critical. Our patients, the function of these transplants is really critical on making certain that they're taking their medicines properly, that they're taking care of their other medical issues. Many of our patients have diabetes. Many of our patients have high blood pressure, heart disease. And so our patients really need to be keeping up with their doctor visits to be certain, again, that, these organs are functioning normally and that they're returning to a healthy life after their transplant.
Thank you. Mr. Mag, what technology and home health care options are available to patients now?
Transplant patients, let's make technology make it easy for you. We offer here a remote track, a home-based solution where you can get your blood work done at the convenient location of your home. Somebody will come to your home, will organize it, make sure that you get all the blood work and your labs done, and we make sure that the results go back to the transplant center or the primary caregiver or your healthcare professional. So let's make technology make it easy for you. With Remote Track, we have an option to get your blood work done in the convenience location of your home.
Thank you. Doctor, what should transplant patients expect as they are recovering from a transplant?
Sure. Well, a few things. The first and most importantly, I would expect patients to be feeling better, to be on a road to great health. It's interesting, shortly after transplants, really within days, oftentimes our patients will say, I feel better than I've felt in years. And so really, most importantly, I would expect patients to start feeling better. The other thing they'll need to expect, though, is that there is a lot of follow-up care. A transplant is a journey, and so they should expect very close follow-up with the transplant center. And finally, I'll say that transplant patients really need to have someone to help them navigate through this time. In other words, having a caregiver help them. It's difficult to do anything alone successfully, and so having a partner through this time is absolutely critical.
And Mr. Mag, what is key for caregivers to be aware of?
Transplant caregivers, you are our heroes. It's amazing what you do caring for transplant patients. My advice is communicate, and keep on top of all the metrics and all the data that there is needed. We have developed AlloCare. It's a very simple iPhone-based app available now in the Apple iStore, in the Apple App Store. And you can download AlloCare and keep track of all the information that there is for your transplant patient.
Wonderful. And finally, where do you think we could send our viewers for more information?
So if you go to caredx.com/remotrack for the home-based phlebotomy option, or caredx.com/remotrack for the AlloCare, caredx.com/AlloCare for the iPhone app, there's more information, lots more information.
Gentlemen, thank you both for your time this morning and for the work you're doing. Thank you.
Thank you.
Thank you.